Good day, class. My name is Jason Kimball, and I'm here to speak to you guys on the topic of safety on the job. Please continue watching. So, the first thing that you've got to know is the definition of job safety. Job safety is defined as a professional area of work that prevents undergoing or causing hurt, injury, or loss for patients and employees. The importance of job safety. To prevent the following: diagnostic errors means a diagnosis was either wrong, missed, or unintentionally delayed. Healthcare infections is an infection a patient receives while being treated for a medical condition. Falls, a common cause of injury within elderly individuals. Medication errors is when a patient receives the wrong medication or receives the wrong dosage. Readmission is when a patient needs to return to treatment less than 30 days after being discharged. Wrong site surgery, when an operation is done on the wrong part of the body or on the wrong person. Now I'm going to speak about job safety techniques. Never bend at your waist. This can cause further injury later in your nursing career. Always bend at the knees and lift with your legs. This is the proper way of lifting objects and preventing injury. When dealing with patient, always raise the bed to mid-waist and make sure arms and legs are shoulder length apart. This provides proper body alignment for you when dealing with the patient. Be aware of your surroundings and look for chemical spills. Know how to use medical equipment properly when dealing with a patient. Safe patient handling. When dealing with the patient, always wash your hands for 20 seconds. Make sure you get up underneath your nails, in between your fingers, on top of your hands, and around your wrists. Put on gloves directly after. Bed positioning. Make sure the head of the bed is elevated no more than 30 degrees. Tilt the patient's hips and shoulders at a 30-degree from supine position. Make sure to place pillows or wedges to prevent pressure ulcers from occurring. Repositioning patients every 2 hours is highly important. This prevents pressure ulcers from occurring. Turning a patient. Explain what you are doing to the patient so the patient knows what to expect and encourage the patient to help if possible. Adjust the bed to a level that reduces back strain on you and make sure to make the bed flat to make it easier on yourself. Get as close to the patient as you can. Place your hands on the patient's shoulder and the other hand on their hip. Standing with one foot ahead of the other, shift your weight to your front foot as you gently pull the patient's shoulder towards you. Then lift your weight to your back foot as you gently pull the patient's hip towards you. Repeat a few times until the patient is comfortable and is in the correct body alignment. Safe patient handling conclusion. Pressure injuries, another name for pressure ulcers, impact an estimated 2.5 million patients each year in the U.S. Most pressure injuries are unavoidable. Most can be prevented. This can be prevented by moving and changing the position of the patient frequently. This means repositioning patients every 2 hours. Safety needles. Sharp injuries expose healthcare workers to bloodborne pathogens and continue to be a serious safety hazard. The Centers for Disease Control and Prevention, also known as the CDC, estimates that about 385,000 sharps-related injuries occur annually among healthcare working inside the hospital. It has been estimated about half or more of sharp injuries go unreported. Most reported sharps injuries involving nursing staff, but laboratory staff, physicians, housekeepers, and other healthcare workers are also injured. Safety needles conclusion. It is important to follow these steps when dealing with needles. Always wear gloves when dealing with a needle or when sticking a patient for lab work. Never, I repeat, never recap a needle. This can prevent you from getting sticked by the needle. Once you are finished with the needle, dispose of the needle in the proper biohazard red container. This prevents infectious diseases like HIV or hepatitis B and C. Isolation safety. Isolation precautions are used to help stop the spread of germs from one person to another. The goal is to protect patients, their families, and other visitors and healthcare workers, and stop the germs from spreading across the healthcare setting. If you or a family member has been placed on a transmission precaution, there will be a sign on the door to remind each visitor and healthcare provider that precautions are needed. There are 3 types: contact precautions, used for infectious diseases or germs that are spread by touching the patient or items in the room. MRSA, VRE, diarrhea, illnesses, C. diff, open wounds, or RSV. Droplet precautions, used for diseases or germs that are spread in tiny droplets caused by coughing or sneezing, like pneumonia, influenza, whooping cough, or a bacterial meningitis. Airborne precautions, used for diseases or very small germs that are spread through the air from one person to another. For instance, tuberculosis, measles, or chickenpox. Preventing influenza. The best way to prevent seasonal flu is to get vaccinated each year. But good health habits like covering your cough and washing your hands often can help stop the spread of the germ and prevent respiratory illnesses like influenza. There are flu antibacterial drugs that can be used to treat and prevent the flu. Steps to prevent influenza. Avoid close contact with people who are sick. This means when you are sick, keep your distance from others to prevent the spread of the sickness. Stay home when you are sick, which will help prevent the spreading of the illness. Cover your mouth and nose when you sneeze. Clean your hands often to help protect yourself from getting the illness. And if soap and water are not available, use hand sanitizer. Avoid touching your eyes, nose, and mouth because germs are spread when people touch something that has been contaminated with the germs. Always remember to practice good health habits, which means clean and disinfect frequently touched surfaces and toys at home, work, or school, especially when someone else is ill. Get plenty of sleep, be physically active, manage your stress, drink plenty of fluids like water, and eat a nutritious diet. These are my references. Thank you for watching. I hope you have learned the importance of safety on the job.